I hope this July 2020 update finds you and your loved ones safe and well. As promised, I wanted to provide some updated information in the middle of the pandemic as there are a few more knowns that have been discovered throughout the COVID outbreak. The first topic I want to briefly touch on is the concept of flatten the curve. And what I found in my discussions with family and friends is there's been a lot of confusion around what the concept of flatten the curve really means. The ultimate goal was to keep the healthcare system capacity manageable so that the system wasn't overburdened with too many individuals needing critical care at one given time. So many governments around the world implemented lockdowns, curfews, and regulations in an attempt to keep the number of hospital beds available at a reasonable amount. What I find wasn't properly conveyed at that time is that flatten the curve didn't mean less people would get the virus. The same amount of people would get the virus whether lockdowns occurred or not. They just happen over a longer period of time. And I think that this visualization on the screen kind of indicates that and shows you that this really just happens over a longer period of time. And this, rightfully so, is a debatable topic. Whether society and global economies and public health would have been best served to let the virus just run its course quickly, or if lockdowns and its effect on economies were worth it. And I promised at the start of the course to only provide subjective content in the course, so I'm not going to share my personal thoughts on that debate. But I do want to say it is a valid debate from both perspectives, and one that I think should be had in order to determine how, as a global society, we might handle a similar pandemic situation in the future if one occurs. I also wanted to take a quick look at the current status of the spread. As you can see, what I had mentioned in the previous slide regarding flatten the curve is quite visible in this daily case count of the US. And by late March or early April, lockdowns were widespread throughout the majority of the US, and those were lifted at the end of May and early June. And now you're seeing that those who were previously kept in lockdown and weren't getting the virus are now getting the virus because they're back in society. So statistically, the majority of these new cases are in the 20s to 30s age group, which we know, unless they have immunocompromising diseases, the fatality rate in that age group is 0.1%, possibly even lower based on some of the newest data. Of course, we still need to protect our vulnerable populations, but more new cases doesn't necessarily mean another significant increase in deaths. There's going to be a natural bump in new deaths due to more overall cases and the likelihood that at least a reasonable portion of those new cases are older adults and those who have multiple chronic conditions. But I think within a few weeks we should see if deaths peak significantly high again or if they stay lower than the death peak in the US, which you can look at this graph and see that it occurred right around April 15th. And we're seeing now at this point in this recording towards the end of July, it is, a slight uptick over the point that we had plateaued there in June. So I'll just be curious if that rises to the point of where we previously were, if it stays a little bit lower given that so many of these new cases are in a younger population. So I think if we could make an assumption, might be that we'll see another little peak here, but I think that it might stay a little bit lower than that original peak if it stands true that the majority of these new cases are in less vulnerable populations. With regards to the spread, we're also learning through research that in many cases there are super spreader events. So what this means is you might have 5 different people with COVID, and for example, 4 of 5 don't actually spread the virus to anyone, or they might only spread it to one person. However, the 5th person might spread the virus to 10 or 15 people. A recent study showed that 2% of people were responsible for 20% of transmissions, and this actually has a really big impact on what we call the rate of transmission, or R0. With R0, we want the value to be at 1.0 or lower, which means that if one person has the virus, they'll spread it to one other person, or ideally none. To put it into perspective, the COVID R0 has been estimated between 1 and 2, meaning that one person is likely to spread it to 1 or 2 other people. And to put it into further perspective, measles, for example, has a R0 value of 18, meaning that one person typically spreads the virus to 18 others. And then those 18 that have it spread it to 18 each individual person. So you see how this very quickly magnifies the spread. So why does this matter with super spreader events? Because the 1 to 2 R0 for COVID is actually a bit misleading if many individuals don't spread the virus to anyone, but one spreads it to many. So it's just something to think about, and I just put this little visualization together quickly to show you what this means from a visualization perspective. So person A, person B, person D, and person E, all with COVID, don't necessarily spread it to anybody, but person C spreads it to many. And that's what they mean by a super spreader event, because you might see that terminology start coming up more and more often as we dive more and understand that many of these cases are super spreader events. The last update I want to provide is with regards to many of the headlines I've seen about a second wave of COVID, and they're talking about this in this current time of July being a second wave of COVID. So the true definition of a trend can differ depending on the field and how you analyze data and other factors, but I want to use two states, Florida and New York, as examples of how I look at it. Some might argue that in April, most states experienced a first wave and are now in July experiencing a second wave. And this might look to be the case when you look at country level data like we did earlier, and you see a little bit of a jump in April and then you see another jump in July. But when you break it down by state, you get a different story. And when looking at new daily case counts for Florida across the entire pandemic timeline, you can see that I call it a delayed first wave, and that's what I think you see here. There was never really a true peak in April, as you can see. It's just a little bit of a plateau through April, May, and June during the lockdown. But there is certainly a peak when you look at the end of June and into July once they stopped the quarantine. And this again is just due to that flatten the curve concept we talked about earlier. So those lockdowns prevented a true first wave of COVID when it initially began to spread in the US. And now with those lockdowns lifted, we're seeing that delayed first wave and not a second wave. So to confirm this, I want to look at New York, which is to the right. And New York was one of the largest drivers of cases in the US during that first April wave, and at one point accounting for 50% of all cases in the country. That's now shifted downwards since other states are experiencing their first true waves. New York experienced its first wave in April, and that's what we're seeing is, New York had these cases in April that now we're seeing a first wave in other states in July. So New York experienced its first wave in April, and cases have been pretty steady since then, and even staying consistent in early July when many other states like Florida, Texas, California, and Arizona began to experience their first wave. So this shows that there's not really a second wave, only a first wave for both states. Florida's was just delayed due to lockdowns. And it's actually extremely rare in the case of a viral spread to experience a second wave with that virus in the same season. And if we look at flu data throughout the year, for example, it takes on a bell curve pattern, and this happens annually, where flu tends to outbreak from September to April with a singular peak, typically in late winter, early spring. And we're so far seeing that one wave, one peak pattern to be the same with COVID throughout the world. It's just happening at different time periods because of those governmental lockdowns. And not to say that it's impossible that we won't see a second wave, but at this point, as of July 2020, I'm not seeing any data globally to indicate that a second wave of COVID would hit this year. If the virus were to mutate, it is possible we'd see a new spread of the virus come winter or spring of 2021, but at this point I think it's too early to assume what may or may not happen come that point. I hope you found this update to be helpful.